giving people the news. I'm very fortunate that I'm able to do that every morning. We are New York. Welcome back on this Saturday. There's not enough research on major medical problems like diabetes and heart disease when it comes to the Hispanic community. That's the claim by the head of the National Alliance for Hispanic Health. She aims to provide information and tips for good health with a series of new books. The first two have just been released. Linda Beccaro explains in this week's Visiones.
This is a public affairs presentation from 4 New York. Visiones.
Heart disease and diabetes are two top health concerns for the nation's 50 million Latinos. Dr. Jane Delgado guides readers through a plan to improve your health in her two new books, the Buena Salud Guide for a Healthy Heart and the Buena Salud Guide to Diabetes and Your Life. Good to see you, Jane. You've been here before in our program. You started these books with a personal story about your mom, perhaps showing some of the cultural differences. Tell me about that.
Well, the important thing is, health is personal, and I can't talk to people about their health unless I talk to them about mine. My mother's story was that she was one of these people who was thin, exercised every day of her life, but she ended up dying from bypass surgery that didn't work.
And this book really puts sort of an action plan, empowers the readers. Tell me what some of your bullet points are for people to take control of their health.
Well, remember that even though we are likely to get diabetes, it's not 100%. So we can do things like not smoke, eat healthy, exercise, the kinds of things you do for a good heart too. The problem is that in our community, people don't see the doctor for wellness visits. So going for wellness visits is key. We take our children, we don't take ourselves. So that's one thing. The other thing is, we don't smoke that much, so we shouldn't start. We also have to be careful about the chemicals that we work with. A lot of people, whether you're cleaning your own house or you're working in an environment, there's lots to think about, and we don't.
And what about with diabetes? Because, obviously diet is a big part of it, and how do you sort of guide people through, unfortunately, some of our choices are not always the healthiest.
What? Exactly. That's the point. When Hispanics first arrive in the U.S., they seem to have excellent health habits. Over time, those degenerate, so that even though actually we live longer than non-Hispanic whites, our health deteriorates because once we have a lot of choices, like human beings, we start making bad choices.
Unfortunately.
Unfortunately.
There's a lot of information in the books. It's a great power action plan for people. They're called the Buena Salud Guide for a Healthy Heart and Guide to Diabetes and Your Life. Dr. Jane Delgado, thank you so much.
I'm your produce man.
Oh yeah, we love the music, folks. They held from